Imagine waking up and noticing a slight yellowish tint to your skin, swollen feet, or even your nails turning completely white. These may seem like small issues, but they could be your body's warning signs of something much more serious: liver damage. The liver plays a crucial role in detoxifying harmful substances and supporting digestion. Yet liver disease is shockingly common, affecting over 25% of the global population. The biggest concern? Many people don't even realize they have liver damage until it's too late. In this video, we're revealing 12 surprising and often overlooked signs of liver damage you shouldn't ignore. Some of these symptoms may even catch you off guard. If you recognize any of these warning signs in yourself, it could be time to act. Stick around till the end to learn how to identify these early warning signs and take action to protect your liver. And if you find this video helpful, don't forget to hit like and subscribe for more life-saving health tips. The liver is a powerhouse organ that plays a vital role in keeping your body healthy. It detoxifies harmful substances, helps digest food, stores energy, and regulates important processes like hormone production. But when it's under stress or damaged, it can struggle to perform these functions properly. Liver damage can happen for many reasons, including excessive alcohol use, poor diet, viral infections, or even certain medications. Unfortunately, liver problems often don't show obvious symptoms until they're advanced. That's why it's crucial to pay attention to the early warning signs. Now let's dive into the 12 weird yet critical signs that could mean your liver is in trouble. One of the liver's key jobs is producing bile, a substance that helps digest fats and gives your stool its typical brown color. If you notice your stool turning pale, clay-colored, or even floating in the water, it could be a red flag that something's wrong with your liver. This change in stool color often happens when bile flow is disrupted, which can occur due to conditions like fatty liver disease or blockages in the bile ducts. When the liver can't produce or release enough bile, waste products in the digestive system aren't broken down properly, leading to unusual stool colors. While pale stools on their own may not be alarming, if you notice this along with other symptoms like abdominal pain or fatigue, it's definitely worth getting checked out. Struggling to see clearly at night or having trouble adjusting to dimly lit areas might seem like a minor inconvenience, but it could actually be a sign of liver trouble. Your liver plays a key role in processing and storing vitamin A, which is essential for maintaining healthy vision, especially in low-light conditions. When your liver is damaged or not functioning properly, it may not be able to store or release enough vitamin A, leading to a deficiency. This deficiency can cause night blindness, where it's harder to see in the dark, as well as dry or irritated eyes. If you've noticed that you're having trouble seeing in the dark, it's important to pay attention to your liver health. This could be an early warning sign that your liver is struggling to keep your body in balance. If you suddenly notice unexplained swelling in your right foot or ankle, it could be more than just a temporary issue. It might be a warning sign of liver problems. The liver plays a key role in maintaining fluid balance in the body, and when it becomes damaged, it can disrupt normal blood flow. This disruption often leads to fluid retention, particularly in the lower extremities, like your feet and ankles. If you notice that your foot is swollen and pressing on the area leaves an indentation, a condition known as pitting edema, it's a sign that excess fluid is building up in your tissues. While occasional swelling can happen for many reasons, if it becomes persistent or is accompanied by other symptoms like fatigue or jaundice, it's worth considering that your liver might not be functioning as it should. If you notice small white or yellowish bumps around your eyelids, it could be a surprising clue that your liver is struggling. These growths, known as xanthelasma, often appear as soft, fatty deposits around the eyes. They can develop when your liver isn't processing cholesterol properly, causing it to build up in the bloodstream. When the liver can't break down fats as it should, cholesterol levels can rise and form these visible growths. While they may not cause pain, they're often a sign of an underlying issue with liver function. If you see these growths, especially if they're accompanied by other symptoms like fatigue or digestive issues, it might be time to take a closer look at your liver health. If you frequently experience discomfort or a feeling of pressure just under your right rib cage, especially after eating, it could be a sign that your liver is under stress. The liver's role in producing bile is essential for digestion, but when it becomes damaged, bile can thicken and turn into sludge. This causes congestion in the gallbladder, leading to pain and discomfort in the upper abdomen, particularly on the right side. In some cases, the pain can even radiate to the right shoulder, as the liver and gallbladder are closely connected. If this discomfort is persistent or worsens after meals, it's a good idea to check in with a healthcare professional, as it may indicate that your liver is struggling to function properly. Your liver is essential for producing proteins that help your blood clot properly. When the liver is damaged, it struggles to make enough of these clotting proteins, which can lead to unusual symptoms like easy bruising or the appearance of red or purple spots on your skin. These spots, known as petechiae, often show up on your legs, arms, or torso and may look like tiny pinpricks. Since your blood is more prone to leaking from small vessels under the skin, you may also notice unexplained bruising or darker areas of skin that don't seem to heal as quickly. If you begin to see these spots regularly or in combination with other liver-related symptoms, it's a strong signal that your liver's ability to function properly is compromised and should be evaluated by a doctor. Real quick, if you're looking to improve your overall health and shed some belly fat without having to exercise, I've got something just for you. My free ebook, Flat Belly Formula Diet-Driven Secrets for Losing Weight Without Exercise, is packed with simple, effective diet tips that can help you lose weight, boost your energy, and start feeling your best without spending hours in the gym. Click the link in the description to download it now and get started on your transformation. If you've noticed your heels becoming dry, rough, or even cracking, it could be a sign that your liver isn't functioning as it should. The liver plays an important role in processing nutrients, including vitamin B3, which is essential for maintaining healthy skin. When your liver is damaged, it often redirects the available vitamin B3 to repair internal tissues, leaving less for skin health. As a result, you may experience dry, cracked skin, particularly on your feet and heels. These cracks can be painful and prone to infection, which can worsen if not treated. If you're dealing with persistent dry skin, despite proper hydration and skin care, it could be an indicator that your liver needs attention. If you've been experiencing an uncontrollable urge to scratch your palms, the soles of your feet, or other areas of your body, it could be a sign that your liver is in trouble. When the liver is damaged, it struggles to process bile acids properly, causing them to build up in the bloodstream. This accumulation of bile acids can then settle under the skin, triggering an allergic-like reaction that results in intense itching. This type of itching, known as pruritus, is often persistent and can worsen at night. It's important to note that the itching typically doesn't come with any visible rash, which can make it hard to diagnose. If you're constantly itching, particularly along with other symptoms like jaundice or unexplained fatigue, it's a good idea to have your liver function checked. If you've noticed your nails losing their natural pink color and turning completely white or developing a rounded bulbous shape, this could be a concerning sign of liver disease. Healthy nails typically have a pinkish hue, but when the liver is severely damaged, it can affect blood flow and nutrient delivery to your extremities, leading to changes in nail appearance. All white nails, also known as leukonychia, are often seen in individuals with liver conditions like cirrhosis, with studies showing that up to 8 out of 10 people with severe liver scarring experience this symptom. Another related change is clubbed nails, where the nails become thicker and more rounded, often indicating long-term liver issues or other systemic health problems. If you notice these changes in your nails, especially in combination with other liver-related symptoms, it's important to seek medical advice as soon as possible. Early detection and treatment can help prevent further damage. If you've noticed your urine appearing dark amber, brown, or even cola-like in color, it could be a sign that your liver isn't functioning properly. One of the liver's key roles is breaking down a substance called bilirubin, which is a byproduct of red blood cell breakdown. When the liver is damaged, it may struggle to process bilirubin efficiently, causing it to build up in the bloodstream and be excreted through urine, resulting in its dark color. While dark urine is a common symptom of liver problems, it can also be caused by other factors, such as dehydration or certain medications like antibiotics or birth control pills. However, If your urine consistently appears darker than usual and is accompanied by other signs like jaundice or abdominal discomfort, it's a good idea to have your liver health evaluated. One of the most noticeable signs of liver damage is a yellowish tinge to your skin or the whites of your eyes, a condition known as jaundice. This occurs when the liver is no longer able to filter bilirubin properly, a waste product from the breakdown of red blood cells. When bilirubin builds up in the blood, it causes a yellowish discoloration of the skin and eyes. Jaundice can be a sign of several serious liver conditions, including hepatitis, cirrhosis, or even liver damage caused by certain medications. If you notice your skin or eyes turning yellow, it's a strong indicator that your liver is struggling, and you should seek medical attention as soon as possible. If you've spotted small red dots on your skin with tiny blood vessels branching out in a web-like pattern, these are known as spider veins. While they can appear harmless, they can actually be a sign of liver dysfunction. The liver is responsible for regulating hormone levels in the body, and when it's not functioning properly, it can lead to an imbalance, particularly an increase in estrogen levels. Elevated estrogen levels can weaken blood vessels, causing them to break and form visible spider-like veins, often on the face, chest, or legs. These veins appear as small red or purple spots with fine radiating blood vessels. If you're noticing more spider veins than usual, especially in combination with other liver-related symptoms, it might be time to check your liver health. If you notice any of the symptoms mentioned in this video, it's essential not to ignore them. Your liver plays a critical role in overall health, and early detection of liver issues can make a huge difference in your recovery. The first step is to consult a healthcare professional. A doctor will likely recommend diagnostic tests like an ultrasound or blood test to check your liver's condition and determine the extent of any damage. Getting a proper diagnosis is the first step in addressing liver health, so don't hesitate to reach out to a medical professional if you experience any signs of liver trouble. The good news is that the liver is a remarkable organ with an incredible ability to regenerate. If caught early and with the right lifestyle changes, it's possible to help your liver recover and function more efficiently. Here are some effective ways you can start healing your liver today. A healthy diet is the cornerstone of liver health. Start by cutting back on processed foods, sugars, and alcohol. These can overload the liver and contribute to inflammation and fat buildup. Also, try to avoid starchy flour-based foods like bread, pasta, and soda, as they can spike blood sugar and worsen liver damage. Certain foods are especially beneficial for liver health. Include bitter and sulfur-rich vegetables like garlic, onions, cabbage, broccoli, and Brussels sprouts in your diet. These vegetables support detoxification and help reduce inflammation in the liver. Yes, you read that right. Studies suggest that the polyphenols in coffee and the curcumin in turmeric work together to reduce liver inflammation and scarring. A cup of coffee with a pinch of turmeric could help support liver health while giving you a boost of energy. Intermittent fasting, such as eating within a 6-hour window and fasting for the remaining 18 hours, allows your liver to rest and regenerate. This practice helps the liver detoxify, repair, and optimize its functions. Always check with your doctor before starting fasting, especially if you have underlying health issues. Many processed oils like corn, soybean, and canola oil can cause inflammation and contribute to liver stress. Switch to healthy fats like extra virgin olive oil and coconut oil, which are gentler on the liver and promote better health. As the liver struggles to detoxify, it's sometimes helpful to take purified bile salts or digestive enzymes with ox bile. These supplements can assist in liver detoxification and prevent the formation of gallstones by improving bile flow and digestion. These lifestyle changes can go a long way in supporting your liver's health and helping it regenerate. Your liver works around the clock to keep you healthy, filtering toxins, aiding digestion, and helping with countless essential processes. But when it starts to fail or become damaged, your body sends out warning signals. Recognizing these 12 unusual symptoms early could be the key to preventing more serious liver damage down the road. Imagine waking up one morning feeling a tightness in your chest, struggling to breathe, or suddenly experiencing dizziness. These are alarming symptoms that often precede a heart attack, a life-threatening condition that can strike without warning. The scary truth is, many people are unaware of their heart health until it's too late. Atherosclerosis, a condition where plaque builds up in the arteries and restricts blood flow to the heart, is one of the leading causes of heart attacks. The worst part? It often goes unnoticed until it's critical, putting you at risk of serious cardiovascular events. In fact, studies show that nearly half of people with heart disease don't realize they have a problem until it's too late. That's why it's crucial to take proactive steps to protect your heart, starting with the foods you eat. In this video, we'll reveal the top 8 vegetables that can help prevent heart attacks, boost heart health, and keep your arteries in top shape. These powerhouse veggies are packed with nutrients that can reduce your risk of heart disease. So, stick around until the end to discover which veggies could be your heart's best friend. And don't forget to hit that like button, subscribe, and turn on the notification bell so you never miss an update to help you live healthier. Garlic. Garlic isn't just a kitchen staple, it's a heart health powerhouse. This humble ingredient contains a powerful compound called allicin, which is released when garlic is crushed or chopped. Allicin has amazing anti-inflammatory, antioxidant, and cardioprotective properties that help reduce oxidative stress and inflammation, 2 key culprits behind heart disease. But garlic's heart-healthy benefits don't stop there. One of its most impressive perks is its ability to lower blood pressure. High blood pressure, often called the silent killer, can quietly damage your arteries and increase the risk of heart attacks or strokes. Thankfully, garlic has been shown to help lower blood pressure by boosting the production of nitric oxide, a molecule that relaxes and widens blood vessels for better blood flow. Garlic also helps manage cholesterol levels. High LDL cholesterol, or bad cholesterol, contributes to plaque buildup in the arteries, increasing the risk of atherosclerosis. Studies suggest that garlic can lower LDL cholesterol and total cholesterol, helping to keep arteries clear. And there's more. Garlic has anti-thrombotic properties, meaning it helps reduce the formation of blood clots. This is crucial because blood clots can block oxygenated blood from reaching the heart, causing a heart attack. Garlic can help prevent this by inhibiting platelet aggregation, the clumping of blood cells that leads to clots. Whether you prefer it raw, cooked, or in the form of aged garlic extract, adding garlic to your meals, like soups, salads, or pasta dishes, can boost flavor and heart health. Just a quick note, if you're on blood thinners or planning surgery, be sure to consult with your doctor before upping your garlic intake. Tomatoes. Tomatoes are not only a staple in many dishes, but also a heart-healthy powerhouse that deserves a spot in your daily diet. The secret to their cardiovascular benefits lies in lycopene, a powerful antioxidant that gives tomatoes their vibrant red color. Lycopene helps fight off free radicals, reducing oxidative stress and inflammation, 2 major players in heart disease. One of the ways lycopene works its magic is by lowering LDL cholesterol, the bad cholesterol that can build up in your arteries, leading to dangerous plaque formation. Studies have shown that eating lycopene-rich foods like tomatoes can significantly reduce LDL levels, helping keep your arteries clear. But tomatoes have even more heart-boosting benefits. They're packed with potassium, a mineral that plays a key role in maintaining healthy blood pressure. Potassium helps balance sodium levels in your body, easing tension in your blood vessels and promoting better blood flow. This can help prevent hypertension, a major risk factor for heart attacks and strokes. Tomatoes also contain a unique compound called escaloside A, found in the skin and outer wall of the fruit. This compound has been shown to help lower LDL cholesterol and triglycerides, while leaving the good HDL cholesterol intact, further protecting against heart disease. Best of all, tomatoes are incredibly versatile. Whether sliced into salads, blended into smoothies, or cooked into rich sauces, they're an easy and tasty addition to any meal. Fun tip: cooking tomatoes with a bit of olive oil helps release even more lycopene, making it easier for your body to absorb. Spinach. Spinach isn't just a superfood, it's a heart-protecting powerhouse. Packed with nutrients, spinach is loaded with nitrates that convert into nitric oxide in your body. This powerful molecule helps relax and dilate blood vessels, improving blood flow, lowering blood pressure, and reducing strain on your heart, a must for heart health. High blood pressure, or hypertension, is a major risk factor for heart disease, and spinach is an excellent way to help keep it in check. In fact, a study published in the Journal of Nutrition Research found that regularly eating spinach led to significant reductions in both systolic and diastolic blood pressure. But that's not all. Spinach is also rich in potassium, a mineral that supports healthy blood pressure by counteracting the negative effects of sodium. Just a small serving of spinach packs a punch, helping your heart and blood vessels stay strong and function properly. Spinach is also full of antioxidants like lutein and quercetin, which fight oxidative stress, reduce inflammation, and protect blood vessels from damage. This makes it an all-around hero for your cardiovascular health. Adding spinach to your diet is simple and delicious. Toss it in fresh salads, sauté it as a side dish, or throw it into a smoothie for a nutrient boost. Red cabbage. Red cabbage isn't just eye-catching, it's a heart-healthy powerhouse packed with benefits. The rich purple color comes from anthocyanins, a type of antioxidant that plays a huge role in protecting your heart. These antioxidants help reduce inflammation, which is a key factor in heart disease. In fact, studies show that regularly eating anthocyanin-rich foods like red cabbage can lower the risk of heart attacks. But that's not all. Anthocyanins don't just fight inflammation. They've also been linked to lowering blood pressure and reducing cholesterol. One study found that women who ate more anthocyanin-rich foods experienced an impressive 11 to 32% reduction in heart attack risk compared to those who ate less. Plus, red cabbage is a great source of fiber, which helps reduce LDL cholesterol, the bad cholesterol, and promotes healthy blood vessels. Incorporating red cabbage into your meals is easy and tasty. You can enjoy it raw in salads or slaws, or sauté it or steam it for a savory side dish. Whether raw or cooked, red cabbage brings both flavor and heart-healthy nutrients to the table. Before we dive into the next heart-healthy veggie, I want to quickly share something special with you. If you're looking to not only improve your heart health but also shed some extra pounds, I've created a free ebook called Flat Belly Formula: Diet-Driven Secrets for Losing Weight Without Exercise. It's packed with easy-to-follow strategies to help you lose weight by simply tweaking your diet, no exercise required. Want to start feeling and looking your best? Click the link in the description below to download your free copy now and take the first step toward a healthier you. Chili peppers are famous for their fiery heat, but they're also packed with heart-healthy benefits thanks to capsaicin, the compound responsible for that spicy kick. Capsaicin has been shown to improve blood circulation by promoting vasodilation, which helps blood flow more freely, reducing strain on your heart, and boosting overall cardiovascular health. One of the most exciting benefits of chili peppers is their ability to lower cholesterol. Capsaicin helps break down fats in the body, leading to a reduction in LDL cholesterol, or bad cholesterol. Less LDL means less plaque buildup in the arteries, reducing your risk of heart attacks. But that's not all. Chili peppers are also great for fighting inflammation. Chronic inflammation is a major contributor to heart disease, and capsaicin helps reduce this risk by lowering inflammation throughout the body. Research shows that regular chili pepper consumption is linked to a lower risk of heart disease-related mortality. Whether in soups, stews, salads, or sauces, they'll spice up your meals while providing powerful heart benefits. Broccoli is a nutritional powerhouse and a must-have for heart health. This cruciferous veggie is loaded with antioxidants like vitamin C, carotenoids, and flavonoids, which help reduce oxidative stress and inflammation, two major factors that damage arteries and contribute to heart disease. By fighting these harmful processes, broccoli plays a key role in protecting your cardiovascular system and supporting healthy blood vessels. Broccoli is also a fantastic source of fiber, which is crucial for heart health. Just 1 cup of cooked broccoli provides about 5 grams of fiber, helping to lower cholesterol levels and maintain healthy blood pressure. Fiber binds to cholesterol in the digestive tract and removes it from the body, preventing plaque buildup in the arteries and reducing the risk of atherosclerosis. But that's not all. Broccoli is rich in potassium and magnesium, both important minerals for heart health. Potassium helps keep blood pressure in check by balancing sodium levels, while magnesium supports a healthy heart rhythm and proper vascular function. Regularly eating broccoli has even been linked to reduced arterial calcification, a condition where calcium builds up in the arteries, raising the risk of heart disease and stroke. Add broccoli to your meals, whether steamed, roasted, or tossed in a salad, and give your heart the boost it deserves. Pumpkin isn't just for pies, it's a heart-healthy superstar. One of its most impressive benefits is its high potassium content, which is essential for regulating blood pressure. A diet rich in potassium has been linked to a reduced risk of hypertension and stroke, as it helps balance the effects of sodium and promotes blood vessel relaxation. But that's not all. Pumpkin is also loaded with antioxidants like beta-carotene, which the body converts into vitamin A. These antioxidants help protect LDL cholesterol, the bad kind, from oxidation, preventing plaque buildup in the arteries and keeping blood vessels clear and flexible. Pumpkin also contains fiber, which aids in cholesterol management and promotes overall heart health. And don't forget about pumpkin seeds, they're a magnesium-rich snack that's great for your heart. Magnesium helps regulate your heart's electrical activity, maintain steady blood pressure, and supports proper vascular function, lowering the risk of cardiovascular disease. Add pumpkin to your diet in soups, stews, or roasted dishes, and don't skip the seeds, they're heart-healthy too. Sweet potatoes aren't just a seasonal favorite, they're a nutrient-packed vegetable with amazing heart-healthy benefits. Loaded with beta-carotene, an antioxidant that helps fight oxidative stress and inflammation, sweet potatoes work to protect your heart by reducing the two major factors that contribute to cardiovascular diseases. They're also rich in potassium, a mineral that helps regulate blood pressure. Potassium aids in flushing excess sodium from your body and relaxing blood vessels, which helps lower hypertension, a leading cause of heart attacks and strokes. On top of that, the fiber in sweet potatoes supports heart health by lowering LDL cholesterol, the bad cholesterol, and promoting healthy blood vessels. Sweet potatoes are incredibly versatile. Whether baked, mashed, or roasted, they can be added to countless dishes, making them a delicious way to support your heart. Their rich nutrient profile makes them a fantastic addition to any diet focused on reducing heart disease risk. Incorporating these 8 heart-healthy vegetables into your daily meals is a simple but powerful way to protect your cardiovascular health. From garlic and tomatoes to spinach and pumpkin, these nutrient-packed veggies help lower blood pressure, reduce cholesterol, prevent plaque buildup, and improve blood circulation, all key factors in preventing heart attacks. By making these vegetables a regular part of your diet, you're taking proactive steps toward a healthier heart and a longer, more vibrant life. But remember, a balanced diet, regular exercise, and routine medical checkups are all crucial for optimal heart health. So make sure to pair these dietary changes with a well-rounded approach to wellness. If you found this video helpful, hit that like button and subscribe for more tips on living a healthy lifestyle. And if you're hungry for more heart-healthy advice, be sure to watch this next video for more tips on the best vegetables to boost your health.